Morning, y'all. First day of fall, eh? Okay, we need a motion to approve the last committee meeting minutes for the Health, Human, and Social Services meeting. Motion made by Supervisor Simpson, second by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried. Okay, first we have Rob, mental health. Take it away, pal.
I got one.
I have one.
I only have 2 items on the agenda. I'm not sure if there's enough copies there. There was a question that came up at our last meeting about suicide prevention activities in our county. So I invited Allison Reynolds from the Council for Prevention to come. The council is the agency in our 2 counties, Warren and Washington counties, that is focused on suicide prevention initiatives. And a little bit of state funding that we've been able to obtain, we've steered toward their agency. So, put her first on the agenda, and I guess I'll turn it over to Allison. Go ahead.
Thanks, Rob. So I'm Allison Reynolds. I work at the council, and I chair the coalition that we've had running for about almost 3 years now. Within that time period, we've written 3 small grants through the Suicide Prevention Center of New York, which I work with very closely on the state level. So just to give you an idea, Rob and I were actually down at the state conference last week. The new state initiative is out, 1,700 Too Many. That's our number for the state. As far as suicides by state go, New York as a whole, we are very good at preventing suicides. When we take out New York City, then we become the worst out of our country. We are higher than Albany County, Warren County is, and we're about 12 per 100,000. So I'm going to leave this for you today, but it has a nice little map with the counties and where they're all at. I won't get into that too much. As far as the coalition goes, we provide a lot of training, and with that, so our mission as a coalition is educating the community, reducing the stigma around mental health and getting help, and strengthening the communication and coordination of all services, schools, agencies, community-based agencies, and supporting those who've been impacted by mental illness and suicide, so survivors within the family. So here's our card. If you want more information on that, our coalition is on Facebook as well. We've trained over 2,000 individuals in less than 3 years. Basically, that's myself and one other person. And this isn't the coalition isn't my only job. So we've done very, very well. That's why we were asked to present at the state conference last week as a coalition. In Warren County, Warrensburg, Bolton, and Warrensburg, Bolton, Hadley, and Glens Falls have all trained all their staff in schools. So that was great. We've held 2 Suicide Safer Schools workshops with the state, which is an evidence-based program. The only schools that did not participate were Johnsburg and Cambridge. So all other schools within Warren, Washington have had that. They get a binder with all the prevention, postvention, and intervention resources that are available statewide. And from there, that's why they added in more training for staff. It is right now with Governor Cuomo sitting on his desk to have all teachers and school staff trained in some type of suicide prevention training. So we're kind of waiting on that right now. And then as far as agencies, we've been training for many agencies, DSS. We're doing training, open all the time, basically, whoever can come and when it fits in their schedule. So we provide a number of different trainings. We do Safe Talk, which is free through the state. We have great initiatives with the state, so pretty much everything is free. Safe Talk, Assist, youth and adult mental health first aid, and then our postvention training. One of the big areas that we're working on right now is means reduction. That's because we know, especially in the North Country, means are very readily available. So we've, teamed up with our Washington County Law Enforcement. They're providing us gun locks, so we're offering those at all our trainings. So I have a little brochure on that for, just to take with you, and then on additional trainings, the ones that I just mentioned right here, so you can, have some of those as well. Basically, going forward, I can train anytime. I'm gonna actually take some of these with me for my next meeting. But for example, we've trained Office for the Aging staff, Northeast Career Planning, this is just all in the last month. SUNY Adirondack Resident Assistant staff, we've done that for 2 years in a row. We've done 2 billboards, one was on Corinth Road, and the other one was in Washington, on the Boulevard. And we've done PSAs that were created by students, that have ran for 2 years at high times of, you know, during the winter months and holidays and things of that nature. Right now, our group is working on a postvention team, so postvention is after a death or tragic, death. And many other counties have them, like, Rensselaer, Schenectady, which have lower numbers than us right now. The postvention team works to offer supports, intervention, information after a death, because we know that that can reduce contagion and provide prevention as well. So postvention is a time of prevention. So the team has been training, it's all volunteers, agency staff, and other individuals, but I'll leave those, and that's, has a statement of purpose and what it means to be a member. Anybody can join. Availability, the way it's gonna work is a call can come in to myself, we activate the team, and then they can go out and help in the community or school or business or whatever it is.
How do people know that it's a contact to reach out to you? Is that through law enforcement, through schools?
So we're working on our card for the team, and then from there, I have contacts within all the schools, from that workshop before, that I did, the Suicide Safer Schools workshop. Law enforcement, especially on the Washington County side, has been participating all along. This information's been going out to everyone for the last over a year. We've been working on this, so it's really who's come to the meetings, been trained in debriefing and other things. And then from there, they can present those cards to families. You know, we have the coroners on board to present the cards for additional help along the way. Any other?
Well, first of all, Allison, thank you very much for coming, and Rob, thank you for inviting Allison. I had one question, and maybe it just resonates a little bit more when a young adult commits suicide, but would you have the numbers specifically for Warren County as to what age groups are more prevalent?
So one of the things with the coalition is getting the coroners on board to present accurate data. We have one coroner who has responded to my emails and calls to them, and he's been able to give me some data. The highest age range for completion is males, you know, in their 30s to 40s range, sorry, to 50s. That's nationally too. That's the number. Of course, for a youth, it impacts the community, you know, hugely, the ripple effect. So it just, even though the numbers aren't as high for youth, the impact is very high. But I don't have that number. They haven't been able to give, I don't have all the coroners to give me their numbers to make it up to date, and I don't have, they're not breaking it down for me in that sense.
The statewide data has about a 3 or 4 year lag, so we could tell what the numbers were about 3 or 4 years ago.
Okay.
In order to get the current data, they're working with the coroners through the coalition to try to get, you know, direct communication.
Right.
Real-time data.
Yeah. So any help in that sense would be great, as far as, you know, having them, I know it's tough. Washington County, they meet on a quarterly basis, so I've been able to present to that group, and then from there, they're providing the data, through public health. But that hasn't been the case in Warren, to get all of them to provide that. And it also goes along with the opiate crisis. If we're able to get that information from the coroners at a more, you know, constant basis, we know, you know, when there might be higher times or more need, more training in certain areas or towns or things like that. It really helps to pinpoint our work a little bit better.
Supervisor McDevitt?
Yeah, I had coffee last night with, his name's Terry Comio. He is running for coroner and has I think he's an excellent candidate. His background, I think, would piggyback on what Allison is saying here to some extent, in that he has a great deal of background in the drug arena. And we talked last night about him, again, from trying to track, say, heroin deaths, overdose deaths, that have some statistical framework that makes sense. So again, I thought he is a very good fit on that, because that has his attention. Okay, is that considered suicide, a heroin overdose?
It depends on how the coroner, you know, does the pay. It depends on if there was any evidence, if there was a note. That's one thing that we always go back to, is that each person is oftentimes doing it differently. So having a, you know, a systematic approach as a county of how they're tracking it or what they're writing down for information does help to get more of that information on a local level of how to do more work. So it really depends on each corner. Yeah.
Thank you.
Yeah.
Supervisor Brock?
Yes, thanks. I used to work at South Plymouth Falls Middle School, and it was in the paper. They used to talk about this, where each spring a student committed suicide. It almost seemed like a thing. I couldn't talk to the kids to find out, but it seemed almost like you mentioned it like a contagion, and it almost happened regularly. I could think of 5 or 6 kids that I had in class that just each year that was going on. You talk about how that sort of thing happens in schools and stuff.
Contagion really happens around, one, individuals not seeing those warning signs, you know, around the person, and then from there not putting in interventions, and really good postvention. So in postvention, we know that if there is a death, we know that there's gonna be individuals that are more highly impacted. So those individuals, they need more attention. So schools can, you know, rally around. We have our Parsons Adolescent Mobile Team now. They've been a great asset to the coalition and to schools, and the fact that they can be called out to provide more resources in those times. A lot of it goes around the messaging. So not only for the media, but for schools, giving resources to parents of what to look for, giving, you know, not glorifying, not sensationalizing, not pinpointing it on one thing that it was, you know, it was bullying. You know, we know that's not true. It's not one thing, it's many things. And, you know, 90% of individuals that die by suicide have a mental illness that either was diagnosed or wasn't. So, you know, making that information out there, that the more we, you know, intervene earlier on and get someone help, we know that hope and recovery can happen. We know that suicide is 100% preventable. And it really comes down to making those early on interventions. So prevention is a big part of it.
Any other questions for Allison? Okay, thank you very much.
Thank you very much.
Okay, Rob?
The other item on our agenda was our budget. We wanted to go over the budget. Do we need to hand out copies for?
I think it would be helpful, yeah. I don't need one if you have, we already went over it, so if you need to.
not changing.
All right.
Okay, so I think everyone probably knows Harry Carlson is with me today, he's our Deputy Director of Fiscal. There's not too much to comment on in terms of the budget. Overall, it's pretty flat. We have, nominal increase built in our rents. We serve, both Warren and Washington County, so our arrangement has been to rent office space, downtown Glens Falls. And, we have a 2% clause in our rental agreement, so a 2% increase is built in here for rent. Our statewide association of county mental health directors also has a percentage increase in their dues that we pay every year, dues to our association. 3% that's built in. And that, our state aid for the most part is pretty flat. Harry, anything else you want?
With other departments, the biggest cost, any kind of increase is gonna be tied to either personal services and fringe benefits or a combination of the two. And that's something that we can't figure out until, comes through from the budget office. So what's gonna be approved for any kind of increases as far as calculating the fringe benefits other than, like Social Security. That we have to wait on ourselves before we see any kind of increase, or what kind of increase is gonna be tied to our department. Any kind of increase that is noted on for the agencies, though, that's all been covered by state funding, additional state funding. And this year, it's into 17, that's tied to increases to money to agencies that provide care management for children. And also, the state approved a 0.2% COLA effective April 1 of this year. So that's I hesitate to call that an increase, more of a bump, because it's 0.2%, like, we'll receive maybe about $250 increase or bump, the department, but as well as some of the other agencies. But that's basically it. The only other change you might see in our budget is just under our contract. There's a reduction about $14,500. That was just money that we had in our budget at the county to provide contract out for respite services, but the home aides informed us that we weren't supposed to have it there. It was supposed to be over in Parsons, so you'll see an increase in the Parsons and a decrease in our contract amount. We didn't realize you weren't supposed to commingle those funds, so we had to keep it at all one block. It was, OMH does do that kind of approach sometimes. They're very strict on how to use the money and where to use it. But other than that, any kind of increase, as I said, at least to the contracts, is covered by state funding.
Okay.
The other issue that we talk about every year is our forensic psychiatric evaluations, because that is 100% county dollars. And that's on the last page. Next to the last page, last two pages, I guess, toward the bottom there, the psychiatric for the non-criminal, those are family court evaluations. And those have been running, within budget, and in fact, we overran on our criminal expenses this year, which is the top of next. And we had to move some funding over to cover that. We were able to move it from the non-criminal to the criminal, so.
Okay.
This year, we took the approach for 17 to just keep things the same, and they are mandated expenses, so if you figure out how to pay them. These are court-ordered evaluations, don't pass their competency exam, then they have to go to the state hospital
Supervisor Brammer?
Thanks. On the second to last page there, Rob, there's two, I don't know, two of those, so Addictions Care Center.
Okay, the Addictions Care Center, yeah, is a new contract agency. They're actually 820 River Street does, they provide, community residence and supportive living services, for individuals and substance. They are in the process of merging with the Addictions Care Center of Albany. Again, 100% state funding here, but we're moving the 820 contract over to the, Addictions Care Center.
So that's why the other one right below it is going from that, okay, to zero.
So we're gonna zero out 820 because they're really not gonna exist anymore. But the services will remain the same in the county, and, the contract will be with Addictions Care Center.
Okay, I just have one more. So then on the second page, it looks like that same amount is on there again, in like the fourth hunk down.
So that would be our revenue side, right? So
Okay.
that's state
Oh.
aid,
Gotcha. That makes sense.
100%, so it should match, the contract.
Good. Thank you.
And not to get into the, the legalities, 820 River Street has had some issues going back for a couple of years, and I think we're seeing the transition from kind of the old to the new, trying to address the need that maybe taking at the end of a previous organization.
Any other questions for Rob? And Harry? Okay, we will move this on to Supervisor Thomas then, and if there's no other discussion. Thank you, guys. Anything else?
Materials, should I leave these? Is that
Yeah,
okay?
leave those, we'll just, yep, perfect, yep. Okay, I was just informed that Denise from Veteran Services needs to go first. You have a meeting to get to? Okay,
It's gonna be so quick.
okay.
And I apologize, are there hard copies of my budget here? Because Sarah said in her email she would distribute them to the committee.
She emailed distribute them, but you needed to bring copies.
Oh, well, I did not.
It's
It
pretty
wasn't
cut,
clear from her email.
it's pretty cut and dry though.
Yeah,
anyway.
it is really cut and dry. Let me just, and I prefer to stand if you don't mind. There's 4 changes in my budget. Most of them are decreases. They're all contractual accounts. The only thing that was, increased was not under the control of my department, but an increase from another department. Self-insurance, obviously, we got a new vehicle, so it went up, I believe, around $200. Okay, so the insurance on the vehicle went up, but that's it. The other contractual, accounts that went down, are auto supplies and repair, new vehicle, less repair. Automotive gas and oil went down, and I can tell you exactly what, $2,000. Again, new vehicle, less fuel. And outside of that, we lowered our supplies, by, I believe it was $50, under the supplies, for office supplies. And that's it. Literally, that's it. There's nothing else, going on with my budget. Unless you have any other questions.
During this time, we kinda took a sabbatical as far as visiting places because of budget, but can we get a day to get over to see veterans and
Absolutely.
Okay.
Anytime.
maybe we'll coordinate with Amanda and get all of us over them, maybe before our next month's meeting.
That sounds wonderful.
Okay?
Okay, thank you.
Okay, thank you, Denise.
Yes, yes.
Did you wanna mention the reclassification?
Oh, okay, yes, I wasn't sure. It's still up in the air, but Cindy and I had come to the budget meeting and asked if we could possibly reclassify for, within either this year's budget or next year's budget, what they're calling a keyboard specialist typist or whatever. She does much more than just keyboard typist specialist. So we've sent that information into Trish Neninger, and she's evaluating the questionnaire to find out what's best suited for the position, and still it's, you know, I mean, it was just sent to her, so there hasn't been enough time allotted for her to come back with, maybe this position in this grade might best suit Cindy's position. So we're still waiting on that. Anything else? I mean, really, it's kinda still new. Okay? Anything else?
Supervisor Brammer, did you have a question?
I didn't,
Oh, okay.
Do you wanna see, I mean, I have a copy.
no, I pulled it up online.
Okay,
Thank
good,
you.
good. Anything else?
I did have a question, but I was reading it wrong, so.
Oh, okay.
Okay.
Anything else? Thank you so much, everybody.
Denise.
Thank you for letting me go first, butt line. Have a great fall.
Thank you.
Thank you.
Okay, let's get the team from the Office of the Aging up next. Tornado.
Come on up, ladies, you come with me. I think that's what I feel like sometimes. That's overwhelming. Whoops. Maybe I should.
I brought Roseanne and Cindy along with me, 'cause they know a lot more than I do at this point.
Can you state your name? You're the new director, right?
I can.
How are you?
So the first item we have on our agenda is permission to increase our 2016 contract with Tom Clements for legal services in the amount of $5,000. And this is as a result of increased, legal issues, the demand for, and the complexity of the cases that they're having.
Okay, we need a motion to get that on the floor, made by Supervisor Frazier, seconded by Supervisor Brammer. Discussion? Supervisor Brammer?
Do you have any paper agendas with you?
They're supposed to be passing down one for you.
You didn't get one a minute ago?
There's another
Early
one.
on?
That's all right.
It's right there.
She handed it out early.
Ah, there we go.
I thought it made it all the way down, I'm sorry.
Thank you.
Oh,
Thank you.
it wasn't.
Actually, you weren't sitting here, you were
I was
discussing with.
running around, yeah.
Okay, we need I'm sorry, we got a motion and a second, all in favor?
Aye.
Opposed, carried, okay.
And with regards to that, we are gonna have, Mr. Clements come in and work with the staff to see if there's more that we can do in-house instead of making the referrals to him. So we'll try to minimize the cost in the future. So, on to the next item, it's permission for myself to go to the Leadership Institute Conference in Saratoga Springs for a cost of $265.
Okay. Motion made by Supervisor McDonald, seconded by Supervisor Stroud. All in favor?
Aye.
Opposed, carried.
Next one is permission for Roseanne, to go to the New York State Aging Services Conference in Corning, New York. The conference cost is $145, and the room rate cost is $121, and it'll be for 2 nights.
Okay. Motion made by Supervisor Simpson, seconded by Supervisor Stroud. Yes, Supervisor Brammer.
This one and the last one, is this already in the budget? Or can be taken out of your budget? Okay.
Which one, the last
Since
two?
our
All of the trainings.
Yeah, I think it is.
There's money in the
It's been
budget.
in there, we go every year, so
And I did check with Cindy, and she said that the money was in the budget. So,
Okay.
yes.
All in favor?
Aye.
Opposed, carried.
Item number 4 was permission for Catherine Keating to attend the same conference.
Okay, motion made by Supervisor Brammer, seconded by Supervisor Stroud. Discussion? All in favor?
Aye.
Opposed, carried.
And the last one is permission for Suzanne Dornan to attend the New York State Connects NYD Regional Training in Latham on November 15th. And there's no cost for this training, and this one is mandatory.
Okay. Motion made by Supervisor Frazier, seconded by Supervisor McDonald. All in favor?
Aye.
Opposed, carried.
And that's all that we have.
Any questions? How y'all making on the first few days here?
Ladies?
Just getting the feet wet. Yeah, good.
We're happy that she came so quickly. If we'd
Yeah.
gone any further, we might have burned out.
They've all
Okay.
been very helpful in
Nice.
trying to help me get my, self-accustomed to everything.
Excellent, good to hear. Okay, thank you, ladies. Dee, are you staying?
yes, she is.
Yes, I will be staying.
Thank you.
Okay, next we have, social services, please.
must be the budget.
How'd you guess? Oh, good evening.
Yep.
Come on, Jim, we got one more. There you go. We'll share it. I didn't see
Hey,
that.
Maureen, take it away when you're ready.
Okay, I'm ready. Good morning. My first request resolution is notice of intent to fill the vacant position of the director, Countryside Adult Home, salary range between 50,000 53,000, effective September 16th, 2016. This is a mandated position, and one I hope I can quickly fill.
Okay, motion made by Supervisor Simpson, seconded by Supervisor McDonald. I think we knew this one was coming anyway. All in favor?
Aye.
Opposed? Carried.
My second, request resolution is request to authorize agreements between Warren County and its municipalities and the city of Glens Falls to reimburse for a portion of the cost for recreation programs and services for 2016. And we, it's a pass-through from the Department of DSS just passes the money through to the towns for their recreation. And we've been out to see several programs this year and everybody's doing really well. You have a lot of good recreation for children. It's great.
Motion made by Supervisor Frazier, seconded by Supervisor McDonald. Any discussion? All in favor?
Aye.
Opposed? Carried.
The third request is permission for 2 new caseworkers to attend Foundations Part 1 training in Albany from September 13th through the 16th and September 20th to 23rd. And we sent this on before it came up very quickly. So, it's mandated training.
Okay, motion made by Supervisor Strauss, seconded by Supervisor Simpson. Any discussion? Supervisor McDonald?
Forgive me if I'm mistaken, is there a cost for this?
Usually they're $14 a day for the training, and we have a budget for training that we get from the state too, so, we have that covered.
Okay.
And we watch it. We've got a lot of training this year for new people, but,
Okay.
okay,
I'm sorry.
number 4.
Need an all in favor?
Aye.
Opposed? Carried. Okay.
Our next training is, permission for 2 new caseworkers to attend Child Protective Services Response Training in Albany from October 3rd to the 7th, 2016, so they can be on call.
Okay, motion made by Supervisor Simpson, seconded by Supervisor Bramer. Any discussion? All in favor?
Aye.
Opposed? Carried.
Number 5 is a request permission for 2 supervisory staff to attend performance measures organizational consulting training in Albany from October 4 and 5 and October 18th and 19th. And, it's a valuable training for supervisory staff.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor Frazier. Discussion? All in favor?
Aye.
Opposed? Carried.
Request, resolution number 6 is request for permission for 3 new caseworkers to attend Foundations Part 2 training in Albany from November 15th through the 17th and December 6th through the 9th. This is a mandated training.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor Simpson. Discussion? All in favor?
Aye.
Opposed? Carried.
If we can move to D now.
Okay.
I did not print a copy of this agenda, there was just the one item on it. I apologize about that. But, yep. The first item was permission to, create 6 private rooms at Countryside Adult Home in an effort to, attract more potential residents. We were looking at a rate of $125 a day. Our normal semi-private rate is $103.53 a day, which is set by the state. We decided on the 125, and this is something that can be adjusted in the future at any time, you just have to give them 30 days notice. We did get permission from the Department of Health, that oversees our building in particular, and then the, portion of the Department of Health that oversees our funding, as well.
Okay. Go ahead, Supervisor Bramer. Make
I'll
a motion,
I'll
get
make
some
a
report.
motion,
Okay.
yeah.
Supervisor Bramer, seconded by Supervisor McDonald, go ahead.
Like, how are we, I assume there's space, how are you, what if, is there a huge demand, are we gonna have more demand, like, are we gonna do a lottery?
There is, a demand for the private rooms. We would like to set them aside for just private pay residents. Back in 2009, the facility downsized from a 60-bed facility to a 48-bed facility. So there are those rooms available. There's no additional cost as far as furniture goes or anything like that. We would just set aside a couple of our regular semi-private rooms that we have and turn them into private rooms.
When we were on the tour, actually, we brought that up. It would be kind of a neat idea. I know I wouldn't want a roommate, but, I mean, if we could get some people in there.
Yeah, I think there's more potential to get single room, members of there.
And if you look at the other facilities in the area, whether they're assisted living, adult home, or nursing home, all of them generally have private rooms. It's usually a small number, but they do have them. Countryside has never had private rooms in the past, so this is something new we'd like to do. And I mean, I think we can definitely fill those 6 rooms, and then, like I said, hopefully it will create some more residents, you know, a pool out there for it.
Good time
and
to
we
do it
would-
too, because our census is down.
The census is down, yes, yeah.
So
Anything
then,
else?
what happens, is it just first come, first serve, and then when they're full, you just wait?
Well, maybe we create more rooms, I don't know, but
What I would propose is whoever's in the facility currently that is private pay, we could offer them that opportunity. And then whatever is left, like say we have 2 people that wanna go into a private room. So those 2 people would go into 2 of those 6 rooms, and then we would still have 4 remaining ones. So then anytime a potential resident came in, if they were able to pay privately and they wanted a private room, then they would get in that room. It would be a first come, first serve on that basis from that point forward.
anything else for Dee? Dee, I did one thing. I reported at the board meeting about the laundry. Okay. Do you have any updates on as far as where we stand?
I do not. I'm still waiting to hear back from Jeff Tennyson and Kevin Hajos to see if our current, septic system can handle the load. 'Cause the Warrensburg expansion of the sewer line, I just heard today it wasn't gonna be until the spring.
Oh, okay.
So we will wanna see if our current system could
Septic,
hold it.
yeah.
And I'm still waiting to hear back from them. I will send out a second reminder email, today to ask them for that clarification.
I didn't mean to put it in your lap, but I know
Nope,
I kinda started it.
Mhm.
Okay, we need to vote on the last item. We have a motion and a second, all in favor?
Aye.
Opposed? Carried. Okay?
And then with the agenda that we sent out, our overtime report was on that, and that's still pretty consistent with last year's figures.
Okay, thank you, Dee.
I would like to add that why we do not have a director up there, there may be a little more overtime, just in case. I don't want them to have less than they would need, and they were kind of worried, so I said, you know, we certainly want to be taken care of, so if that's something that you need, just let me know, and we would probably approve that. But just in the interim, in case one of the senior aides needs to do some extra work.
Budget Officer Thomas said, no problem.
And there would be that money in the budget. We still have some leeway with the overtime budget, so that would be fine.
Okay, good.
Maybe could do her budget.
Okay, yeah, good idea.
And then we'll go do ours, so
Good
that
idea.
she can leave if she needs.
Good idea.
Thanks, Julie. So our budget is basically the same in comparison to last year's. There's not too much of an increase.
I'm sorry, can you just,
Is that part of this?
Help me refer to which packet this is?
I think it's seven.
603, which
First one.
Second or third bundle?
is.
First one
yeah,
after
it's
the
like your
paperclip.
second bundle is.
You pull the Excel spreadsheets off, it'll be
Oh,
the
should
first
be after the
one.
6010.
Good plan.
We're there?
Okay.
Okay.
Well, that's the dollar, that's coming from
Okay. Yes. We did decrease, did we decrease the overtime budget for next year? So if we go to the 100s, under the 6030, they're all basically the same, relatively the same as compared to last year's numbers. In the 200s, which is our equipment, we did do an increase in the amount of $20,000 to cover the cost of the washer and dryer if we move forward with doing the laundry in-house. Other than that, the two other budgets, the 210 for furnishings and the 270 for lawn and landscaping, those remain the same. Underneath the 400s, the contractual expenses, we tweak things just a little bit, but the main difference in this one would be for contracts under 470, which is on the third page of your packet. And that was to reflect the changes in the Warrensburg Laundry, the increase in their price, and then also to reflect a contract for having a part-time 16-hour-a-week caseworker or case manager at Countryside. So that went from $35,000 up to $61,000. And then all of the other figures are relatively the same as well.
Questions or comments? Supervisor Conover.
How do you handle receivables? Treasurer, end up being due to the county, not the pressure, how exactly are receivables, bills owing,
For the residents, typically what they do is with the, whatever first checks they get in the month, or the year following, those go and pay for any of the 2016 carryovers. And then there are times where we do have residents that are they're unable to pay a back balance, in which case we do go to the treasurer's office and we write them off.
they have to get written off? Do you have an idea if they get written off after 18 months, or?
Usually it's once they're actually discharged from the facility, that's when we do it.
I see.
Because we still try to collect some of it as they're there with us, even after they're discharged, but we usually don't write anything off until after the discharge.
I don't,
I guess I'm not
what's he
hearing
referring, I wasn't paying
an
attention.
increasing fund as receivable as part of the revenue stream. It's actually, deleted as well. And we know it's uncollectible.
Usually what we try to do is, if they're getting funding through our, TA department, is we'll try to get the authorization to increase that funding to help make that, reduce the amount of, and we work with our TA department very closely with that, and they're usually able to approve that funding so that there isn't large balances when somebody leaves. They very rarely find that because of our TA department.
Supervisor Brock.
Do we budget for write-offs? I mean, do you have a, and that says we're gonna have so much in write-offs each year?
No.
No?
Once it's written off, do we still keep it or follow-up or anything? So that, if someone passes away or something, we can go after their,
We work with our resource department on that.
so you keep like a running balance of.
Absolutely.
yes, if there's any funds that can be had, if there's any, property ownership, to be sold, any kind of bank accounts, we
I never heard of that up there, but maybe it
I
happens.
worked in the banking and finance business when we would actually budget for charge-offs and that sort of thing, so we would know. But it's sort of an exercise in trying to figure out where, you know, rough, on average, where things are gonna be and so forth. So I'm a little surprised you don't, I mean, there's no way of predicting it perfectly, but it gives you some way to modify your budget and stuff.
And that's not anything that we, that to my knowledge, that they've ever done at Countryside, had a specific budget just for that. Generally, it's not anything significant, I would say less than $5,000, usually a lot less than that we would actually write off from any year.
Anything else for Dee? You can leave now, Dee.
If you do have any further questions about the Countryside budget, feel free to send me an email, I'd be happy to address it.
Thank you for, getting us through this transition also.
Thank you guys. And Maureen and Julie and the staff at Countryside have been great, trying to help out and get things done.
Good. Okay, Maureen.
Okay, I'm gonna turn the budget over to Julie.
For the 2016 budget, we're really right on target as far as expenses go. We don't have any real issues or anything. It looks like we'll stay under budget for the year. Revenue is a little lower than I'd like to see for August, but I've seen a lot of money coming in for September, so I'm really kind of hoping it'll pick up there. And our overtime was actually way down for the last pay period. We really just got lucky that we had a 2-week period where there weren't a lot of on-call overtime, and we had a little break in training. So although you see it for the last pay period, it's not going to last. So overtime is what it is, and probably less than what we expected it to be. Any questions on 2016?
Supervisor
Okay.
Bramer.
Thank you. What's going on with the revenue? It looks like we're way below what we projected.
When the state does their settlements, we can have a month where we might collect 50,000, 100,000, and then one month we'll have a month where we collect 2.5 million. We have no control over that. That's why at this point I'm really not panicking or too concerned. For September already, we're seeing well over $1 million. So you kind of got to be patient, and eventually they do their settlements.
Okay.
They're not timely, ever.
Any luck in getting any of those on-call caseworkers that, I think we had 4 or 5.
We're interviewing now, we haven't had any decision, we're going through the list.
Okay.
So we're trying, but
Yeah.
we're hoping that we can get that wrapped up in another week or two. Depends whether we have to go back and ask for more names from, civil service, because you get, like, just a certain amount for them, so that we don't, like, get somebody that really shouldn't have been with us yet on the list, so sometimes that takes us just a little bit, but we're interviewing.
Good. Anything else for social services?
Oh, yeah.
Yes, Supervisor.
Can we go over the budget, not just month?
2017?
Yeah.
Go ahead.
Okay. I'm assuming this first sheet is a summary of all the different department codes that are contain
It
the
is.
entire
It's-
packet. And the one thing just that jumped out at me was the first line item, administration is going up, I don't know, $1.5 million. And our projected revenue stream is going down, which concerns me. What can you tell me about that? In the very first line, 60-10,
Yes. That is all of our salaries and benefits. The reimbursement rate is, it stayed the same.
okay, wait, okay, hold on, I messed this up. So it's not going up as much as I thought. I was comparing it to the 2016 revenue, not our adopted budget.
Okay.
Yeah,
What are you looking
okay.
at? I can't see it.
Sorry, I've
No,
played
no,
around
it's
with
not your
this
fault.
sheet a lot
What's the
and
count
trying to
share?
get all the information you need and the columns set up the way for an easy read.
Versus that, okay. Okay, that's a lot more reasonable, yeah. Edna was, Supervisor Fraser was just pointing to me too, the 2016 county share versus the 2017 county share is not going up significantly.
Right.
So that's not as concerning, okay.
If you look at the overall budget, the total county share down at the bottom in the left-hand corner does show you the county share decrease.
No, okay.
However, the 60-10 budget, there are two sheets at the very back of the budget. What I do is, the top sheet is what's actually in the logos budget where we enter our budgets. However, it does not include any, request for increase of salaries and the associated benefits, of course. So if you take those last two sheets, and you'll see I highlighted the increased 60-10 budget, where we have asked for some increases. The increases are to the non-union employees. It includes, on-calls. On-calls had never been budgeted for, and right off the top, it's $16,880 that we pay in on-calls. That's a given. It's
Very conspicuous.
right.
Phone.
That's two people every single day of the year to be on call. So we did ask to put that into our budgets because it's a lot of money. HEAP salaries, HEAP has grown. We used to have 3 part-time staff for HEAP. Now, they'd like 5, we've settled at 4, so we also needed to increase our HEAP budget for that staff. Also, we've had a lot of retirement payouts and/or just if people leave, there's always payouts that have never been budgeted for. We have 2 absolute retirements for next year. There could be more that we don't know about. There could be people resigning and payouts there. I had asked for a little bit to be put into our budgets as well in the event of these. So the total increase request was $172,000. The impact to the county cost was $31,000. So if you look at the increased 60-10 budget, it now reflects if those increases were put in, how it would affect our overall budget. And it went from a decrease of 1.4% to 1.18%. So we're still coming in under the 2016 budget.
Supervisor Strauss.
And the workman's comp, the last page, the the 2017 assessment.
Right, those numbers come from self-insurance based on actual.
Yeah. So, the county covers the fire departments and EMS squads at those various towns listed?
They all have their own budget for,
But we pay, I mean, it's not like the county pays those, right?
those aren't a part of my budget, it's just we're on the same sheet.
Right, oh, okay.
So,
Okay.
the only thing we budget for is the social services
But
team.
they're under the workman's comp program of the county?
Under self-insurance, yeah.
Yeah, we're part of the plan.
Okay,
Right.
all right then. I understand. And, okay, got it. Thank you.
Supervisor Brown?
Okay, thanks. And this might not be something that you wanna discuss right now, but I thought I would raise it now, in social services. We had a request the other day from Open Door for funding. And if it fits anywhere, I think that social services is where it might fit.
Yeah, but not out of their budget, though.
Right.
You think it should come out of their budget?
No.
I don't know. I think, what happened with Open Door, we got a brand new grant this past year that was used for Code Blue. And they came to us after we had run the program, we had submitted all claims and been reimbursed. So as far as we were concerned, we were done, it was closed. And then they came to us and said, hey, we want to be a part of this. So how we left it is if this grant happens again for 2017, which preliminary is, yes, it is going to happen. If it does, if we have it in writing that we're going to get an allocation, then certainly we will contact them and let them be a part of this. If there's money that can be spent, they provide a great service, and if they want to be a part of that, and we will work with them and make it happen. But as of right now, unless you know something I don't, I have not gotten anything stating for that grant will
She
happen.
didn't come back to us about that, and we left it with, she needed to check something, and, I don't know if it wasn't, because it wasn't, I think she wanted to pay staff out of that money, and one of the things that the grant did not pay staffing. So, we said, if you have something else that fits under that grant, we'll take a look at it and try to do things. And she never came back to me, and I didn't hear from Cynthia that she contacted her about that again. So I just figured she thought it was some money to be able to do staffing, because when the governor opened it up, that it was like in 32 or whatever, it made them like need to be open more.
Supervisor Brown?
Oh, okay. That's great to know that grant money might be available. I was looking at the budget code for emergency aid for adults and wondering if there's a way to work in funding for them through that budget line.
Well,
And a whole separate issue is the capital funding that they need for the building.
right, I don't think we can get involved in any capital funding. I don't think that's, because we have talked about that in different ways before, that, maybe it'd be easier if we had things like a house and put people in it rather than hotels all the time. But back when we asked about that before, it was like, you can't do that, it's like, the need is today and this is what you have to do. You can't have say if it had 2 rooms that weren't being used, there's no way for us to pay that. So, and she would need to work with the state to make sure that what her rules are would apply under the different grants or lines here. Sometimes when things are independent, people do different things, but the state either approves or doesn't approve of, so we just have to be careful with that.
Maybe we could report on this as we keep
Yeah.
moving forward, I don't know if we'll make a decision right now.
Yeah. No.
Supervisor Conover?
Yeah, I mean, I think the fundamental question is, but for, this operation, would, these individuals be serviced by other aspects of the safety net? And if not, then, is this a need what we fund and how we fund it. I mean, if you're following what I'm saying, in
Yeah.
other words, that,
Right,
and I guess that
the people that,
your opinion on this is valuable to us in terms of this picture.
the people that choose to go to Code Salute that I have heard from in the past do not come to us because, they don't wanna be associated with the government, or they don't wanna follow the rules and regulations that we have to have about different, that you're not supposed to have anybody in the room with you, that, you know, you can't be out drinking and whatever, that you're there, you have to be looking for a job, and you have to be doing apartment searches. So there's some people, and certainly everybody wants them to be warm when it's freezing outside, but they are at this point in time unwilling or unable to follow the rules, so they don't come up to ask us for help because they know what it entails. But, I mean, I certainly don't want anybody freezing because they won't do that, but, that's what our TA supervisor tells me, because I've asked that, and we don't use that, we don't refer our people down there because they're supposed to be working through us, and, those are the people, when they come up as homeless that we have to sometimes put in the motels around here. And the state is starting to ask us to inspect the motels that we use, make sure there are certain things, some of that, try to figure out who would understand the coding, and so maybe we'll ask our partners over in our building if they would help us. If they ask about codes for motels, yes.
Right. Who pays for the hotel when someone comes and needs a place to stay? Who pays for it?
We do.
So it seems like diverting people from the hotel, an emergency situation would be more advantageous than, I don't know, something that we need to continue to explore, I think.
Supervisor Brock, did you have a?
Yeah, I don't even know who to ask this of, but Claudia brought it up about the, open door and the capital budget. They won't go through you for that, but where will they go through this committee, or, who should, and even more importantly, should they be doing that now, not next year? I mean, the time is of the essence, we're doing the budget.
Look down 2 doors to the right of you. Look down 2 doors to the right of you. Go ahead, Supervisor Thomas.
Yeah, I had a meeting with, Kim Cook on September 14th. As far as our budget, the money she's asking for is for capital construction money. She has an amount, but she doesn't really have any, might take $100. I guess my first question would be, can the county legally, give money to this organization? It's 501c3 or some structure, and, you know, at the town level, you have to have a contract for service. So if you don't have a contract for service, then she's not asking for operational money, she's asking for construction money.
You can't marry those responsibilities.
Then beyond that, I guess it's a budget committee or board decision, if that's what they want to do.
Yeah, and our legal department is working on it also.
Looking for money.
Yeah. Okay. We will follow up on that. Our legal department's looking into it as well, so. Anything else for social services? Seeing that there are none.
Come on, I just have one comment, just really quick. On that same note, Kim Cook did invite all of us to come and tour their existing facility and their new facility on Tuesday after committee meetings around noon, but she's willing to work with us on a time. She wants to be able to highlight, you know, what they are already doing and what they will be able to do. But she did go through Supervisor Gerard, and he wanted me to let everyone know that they have not closed on the building. Kim said that they have been giving tours, it's not been a problem, but Dan felt like it was important for other supervisors to know they have not taken ownership of the property yet. I plan on going on Tuesday after committee meeting.
Tuesday where?
We're gonna meet at the Lawrence Street building first, I think.
Okay. If nothing else, thank you guys, very good job. While we're waiting for public health, I did have a couple of out-of-committee resolutions that needed action. One was to fill a vacant position for the Office of the Aging Assistant, salary of $27,000. And the other one was a convention that, what do we have here? What was this again? This was... Oh, Susan Dorman, that's right, okay.
Oh, they're on hold.
It was just travel, so...
They're in the window, you did.
Okay.
We've got to talk to the administrator about that.
Oh, okay.
How are you, Pat? Thank you, Miss Pat.
Oh, thank you.
Thank you.
I don't know where my other agenda is.
Thank you.
Oh, thank you.
Thank you.
Someone's here?
Yeah.
Someone down there with a hat?
I don't know, it's been sitting there all morning.
Oh. What I didn't do is really...
How are you, Ms. Connie? Here. Huh? More? Okay.
But I asked if I could move it somewhere else.
How's your budget coming?
Well, I'm down to health insurance.
Really?
So,
We're waiting for the department heads to get out. Today was the day for them to have all those turned in, so.
Okay, Pat, we are ready, willing, and able when you are.
Okay, thank you. Happy first day of fall.
Yeah.
Hard to believe, seems like we were just here and the years gone by. I have a additional agenda item from what was transmitted to you earlier in the week, and that is to request committee approval to authorize Maureen Linehan and Lisa Morton to attend the provisions for the quality of life and palliative care in Utica on November 17th. The cost will be $110 for the first employee and $90 for the second, plus meals and tolls. They're gonna go and come in a day. There's sufficient funds to do it, but we're seeing an increasing need for palliative care. It's a new way of delivering services, so if we could have committee approval, we need to do it because it's over $100.
Okay, motion made by Supervisor Simpson, second by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried.
Now moving on to the initially proposed agenda, we would like to request a resolution to authorize Jody Brines to enroll in a job-related course entitled Advanced Practice Nursing Capstone Practicum. It's an online course. She's working on her bachelor's degree, as you've heard in previous months. I sent a copy of the course description with the transmitted materials, but I didn't make a copy for now, but it's clearly very nursing related.
Okay, motion to get this on the floor, Supervisor Bramer, second by Supervisor Stroud. Discussion, Mrs. Bramer? Anybody? All in favor?
Aye.
Opposed? Carried.
Do you have a question?
No, he was teasing me because last meeting I questioned every item. Pretty much.
You'll find out soon enough.
All right, that makes my anxiety level perfect. Okay, moving on, we would need to request a resolution to amend the 2016 Warren County budget to reflect a payment of $963.33 for an insurance company for repairs related to a vehicle, which totaled that amount, and this is from an accident that wasn't our fault, and the other individual's insurance paid.
Okay, motion made by Supervisor Stroud, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, moving on, we would like to request a resolution to transfer funds from the long-term care full-time salary expense to health services part-time, and to transfer funds from health services full-time salary to part-time and in the amount of $44,718. This is, a situation that's covering our per diems because we've had unfilled full-time positions, and luckily for us, that the per diem have really been helping us out, and it's saved a lot of money. So I don't know, Todd, if you have anything to report?
No, that's pretty much it. Thank
No.
God, 'cause we've had quite a few people who've retired who've come back per diem, and we just have to make sure the salaries are over in that category so we can cover those expenses. It saved us on a lot of fringe benefits too.
Yeah, no, great. Okay, motion made by Supervisor Stroud, second by Supervisor McDonald, all in favor?
Aye.
Opposed, carried.
We would also like to request committee approval to authorize Tony Roth, our WIC program coordinator, to attend the 2016 New York State WIC Managers Workshop in Suffern. That's a mandated workshop. It's 100% cost is covered by the WIC program grant, but we need approval because it's overnight.
Motion made by Supervisor Bramer, second by Supervisor Frazier, all in favor?
Aye.
Opposed,
And we would also, we've got a lot of stuff going on in the fall, so that's why you're seeing, all these requests. To authorize Janelle to attend the 2016 New York State, so, United States Public Health Leaders Summit in Thousand Islands, and from October 5th to the 7th. This is always a really good conference, and except for the $25 conference registration fee, gas and tolls, it's fully covered by NYSHO.
motion made by Supervisor Stroud, second by Supervisor Frazier, all in favor?
Aye.
Opposed, carried.
Okay, we would also, like to request a resolution to authorize us to participate in a 5-county grant involving Essex, Franklin, Hamilton, Washington, and Warren counties for a 2-year period that'll target diabetes reduction and intervention strategies. Essex County will be the lead agency for the grant, which we propose to be, written by a grant writer. The cost for the grant writer will be shared equally between each county in an amount of $700. And we'll be utilizing some of the district funds that we were given a couple of months ago, because regional projects are what they're looking to have us do. So this will be the only amount, which will be actually cost to Warren County, and that will be using the district funds, will be the $700.
Okay, motion made by Supervisor Stroud, second by Supervisor Bramer, all in favor?
Aye.
Opposed,
Okay,
carried.
because we've never done this before, I did a little research, and the long and short of it was, we need to request a resolution to authorize the agreement with Vicki Wheaton Saraceni to provide the grant writing services and project organization services for the above initiative. And I did attach the specific scope of work that she would be doing. Warren County share, as I said before, would be a one-time fee of $700. In a form approved by the county attorney. So I called because this was a grant writing service. I did have conversation with Julie Pacina to make sure that I wasn't entering or proposing entering to anything. And she wasn't sure, so she had some conversation with the county attorney, and his plan was suggested we need to do a kind of a short agreement to make sure that everything was fine. So she did give us a good scope, services. She gave us her liability insurance, so I wouldn't think that would be.
Okay. Motion made by Supervisor Bramer, seconded by Supervisor McDonald.
I just have a quick question, and it's just more for my information. With this grant writing service, does this person get that fee if we get the grant accepted, or does it, regardless of the success of the grant, they get that fee anyway?
It doesn't matter one way or the other.
Okay.
It's a gamble. It looks good that we might get it, but again, until the award is actually made, we don't know. But I will tell you that the state is not quick to be handing out grants to just one county. They're looking to do more regional approaches to things, and for like our numbers wouldn't be enough to support it to do it on our own. But
Right.
if you pool the problems in 5 counties, then it's a good, and they like to,
Okay.
like I said, it's 5 counties, that's a good piece of population.
Okay, we have a motion and a second, all in favor?
Aye.
Opposed, carried.
Okay, moving on we don't have any pending items. You'll see attachment number 1 was our emergency response and preparedness activities report. And we didn't have a meeting last month, so it looks a little busier than usual. And also, before I forget it, the flu clinic schedules that we have, because it's not, that has anything to do with emergency preparedness, but it seemed like as good a place as any to bring it up. we aren't doing quite as many this year because you can get flu vaccine all over the place, and that's a good thing. But we still have quite a number of people that look forward to the nurses coming in, and it does give us a good presence in the county to get out and do some
Great.
marketing and that kind of thing, so. Status of referrals, you can see attachment number 4 for the detailed report, and Tammy and Val, if you wanna, comment on that, we're really busy.
Our referrals, I was quite pleased compared to last year, they did go up, so, looking good. We've been certainly busy enough in the last couple of months, and it's showing there as well, with the skilled nursing evaluations and also with our therapy, physical therapy referrals have gone up.
Anybody, that's it? Do you have any questions?
No.
Okay. Dawn?
Attachment number 2 are our current status of financials. We are working on, as a matter of fact, today we will be closing the month of August. Our expenses are down a little and our revenues are down a little, that usually correlates. You'll see on the bottom of attachment 2 our comparison for payroll. Again, what we know is that our part-time salaries are up since we've got a great per diem pool, and you'll see our regular salaries and our overtime are down compared to last year due to this per diem pool. So overall, we're 196,000 plus under last year at this time with payroll. We are at 61.9% of our budget right now, and last year at this time we were at 70.01% of the budget. So you can see that we're keeping that all down. On attachment number 3, which is our comparison at this time last year, basically the same thing. You'll see expenses are down and revenues right now are down, but they're correlating with everything. The biggest thing is our payroll, which of course is down. One thing, our benefits are also down due to the shortage of full-time nursing and being able to utilize the per diem. Another thing again to bring to your attention is the fact that we have quite a few employees, especially newer employees, that don't have the benefits that accrue as fast, that are using compensation time, we call it. They, rather than getting paid overtime, they're comping the time so they can get days off, and that's saving us on overtime too. So that's really helped out a lot with the overtime situation. Our long-term care program has gone away, and there's no patients at all there. That ended, I think, the beginning of June or end of May was our last patient. And one of the things is that the salary person that we had in there, we took that salary and we had asked with part of that adjustment to move that over to our per diem line, so we could cover that per diem for to the end of the year, and I think we'll be okay. That's it.
I have a question. That emphasis on using more per diem, that was something that you guys took on this year, correct?
We've always had per diem, we just never had.
But the heavier emphasis is on that.
Yeah, oh
right?
yeah, definitely. We've had quite a few people retired who have come back and work per diem for us 2 to 3 days, sometimes a week, and it's really, really helped us out a lot.
I just want to applaud you guys for that, you know, putting that emphasis there and using that tool. That's really good management, and the numbers show that, so great job.
I think it works well because when we have people that retire that obviously have a number of years in, and for them to work 5 days a week is pretty daunting, but to work 3 days a week is just perfect, so it helps them and helps us, so.
That's great.
We're so far working out, but you don't want to get too comfortable with per diem, so.
Right.
But for right now, it's good.
Well, it looks like it's cutting down overtime.
Huge, it's working, and like I said, even though they're retired, they're not like, you know, ready for long-term care yet.
Right.
So,
Supervisor Leggett, did you have a question?
Yeah, on the budget analysis there, where it says currently working on closing month of August 16 for health services MCH programs or MCH?
maternal child health. Can never anticipate all of the acronyms, just so we get them, get some new ones going. Okay, regarding, Okay, we're done with the expenditures and revenues?
Yep,
Everybody
yep.
has- Okay, regarding our personnel update, since our last meeting, we've been able to fill, 2 vacant positions with, new nurses that so far, one of the nurses was actually previously employed with our agency and left for greener pastures, but has returned. And, we did, have a resignation from a nurse who no longer wishes to work full-time, but wishes to remain on a per diem basis. So again, we're very thankful for our per diem group, and, we have been able to accept all referrals with no problem. So, and that's really good, because that's not true with other agencies. We also have had, a long-term WIC employee that has retired, and, so we're looking to backfill her position, and I sent all the paperwork here. But just informationally, she was here over 30 years, so, again, we're sorry to see her go, but happy for her.
Okay, motion made by Supervisor Bramer, seconded by Supervisor McDonald. All in favor?
This
Opposed?
is intent to fill that position. Yeah.
Carried. Correct. You're like a tack today.
I got my coffee going. Ready.
Okay, now moving on to, probably the reason you're all here today. Our, budget review, and I'm gonna turn that over to Todd, who, first of all, no matter how you like or don't like our budget, I will say, I wanna give her a lot of accolades, because she has worked very hard and very diligent on this, and I think she, like the rest of us, can't believe it's been a whole year since we were up here doing the same thing. So with that, Todd.
The attachment 8, which is just our budget summary, and that's probably the best for everyone to just kind of look at, you'll see. Kind of color-coded, wanted to note, one of the first things is that we did come under, the 2016, slightly under the 2016 adopted budget. Another thing to note is currently we have 12 departments in our agency, but in 2017, the long-term care program, which as you know right now is no longer, that won't be budgeted. And the Ebola grant ends September 30th, so we will not have that unless we get new grants, but at this point, we don't know of anything new. Some of the highlights on the sheet you're looking at, the yellow are mandated programs, and you'll see that's over $4 million that are considered mandated, our preschool, our early intervention, our disease program, and part of our preventive program, which is, Pat as the director, and Dr., I think it's Larson is our medical director. Those are, those impacts alone, just for mandated, are 85% of our impact to the county. So just to give you an idea, that 85% of our impact is strictly mandated. Of those mandated, the 2 big ones are our preschool and early intervention, and they alone are 65% of our impact to the county. So, and you'll see here, like over $1 million is the cost estimated, and usually is around for the preschool program, and that's mandated. There's nothing we can do there. The light orange or peachy color, those are our suggestions for payroll and fringe. Just to give you an idea, the big thing that we did for the 2017 budget to get it, like you said, this year has been the big year with per diem, so we have to get that per diem line up in the budget. So we have transferred our long-term care position that was in the budget and another full-time position over to the per diem or part-time line, saving benefits there, no health or dental for those, so that's saving us. We've eliminated another full-time position within that. Right now, we're able to take with what we are and with the good per diem that we have. We're hoping that that'll keep stable next year. We've also, since our Ebola grant is going away, the person that is putting 4 hours a week in that grant right now, we've requested from the state if those 4 hours can be moved over to the BT program. So that's just a wash. We're taking it out of Ebola and putting it into BT. But the bottom line effect is over $175,000 is what we're reducing in both, we're requesting to reduce in both salary and fringe. Also to note that the BT and the WIC program are both fully funded, so they cost the county nothing. We get that from the state with both grants. One new thing different this year with our WIC grant, which we've never had before, but they did it this year, is they included the COLA, cost of living adjustment, within the grant this year. So we don't have to come back and request that. So that's already a part of these numbers. And the other thing I just wanted to bring up, one thing that we were watching on and it's worked out very well, is our inventory in the home care. You know, we have to keep stuff and we have to order special stuff for patients, but trying to keep that inventory down so we don't have a lot. And the staff has been wonderful about working with that and keeping those numbers down, which has kept our expenses down, and we continue to plan on doing that during 2017. So those are some of the big things that impacted our budget. The big thing, of course, is payroll, and again, just wanted you to know how much mandated programs are out of the whole picture.
I didn't wanna ask, but of course, now I'm embarrassed, but I'm gonna ask anyway. And I'm asking the committee, normally are, raises rolled into the budget? Or is that asked for at a later time?
Which
Or
ones?
not, just not
yeah.
given?
Which ones, Claudia?
Like,
We're negotiating with the CSEA, so none of the CSEA information is included in the budget because we're negotiating a contract.
And everyone on health services is a union?
Well,
Most people?
Most people are.
yeah.
All the nurses?
The
Okay.
non-union raises go through the budget officer. He'll make that determination before he submits his budget.
Okay.
Anything else? Do you have, oh, I'm sorry.
Is that correct, Frank?
Supervisor Cano?
First, once again, the financials, I mean, the whole program, but, the financials are just crystal clear here. Just a comment that, reduction in the code that you're seeing this year is what is accounting for the $175,000 reduction in next year's budget.
Correct, moving full-time to part-time, which is what we're gradually doing this year, moving it over to the per diem line to cover it, but we're making it official, eliminating a couple full-time positions, putting that salary in the per diem part-time line, and eliminating those benefits. The only thing we did say during budget meeting is if things start turning around, we may have to come back and ask for full-time, or if our per diems start to say we're not gonna work anymore, and then we have to get full-time to cover that, or if we can get more per diem, but whichever way it flows is what we'll have to request. Right now, we feel steady with what we're at right now. Been talking with Val, and we've, like I said, 2 or 3 new nurses within the last month. So, I think we're good.
Well, it's so refreshing to come into a committee meeting and have such a clear picture of where we are and what that means in terms of next year, and, you know, Pat, my compliments to you and saying.
I could take no credit for it, I gotta tell you.
From a supervisor's point of view, I mean, it's just so crystal clear and so immediate, the implications, but sometimes it isn't always good, you know, sometimes it can go the other way.
Right.
Kudos to everyone.
Thank you. Okay, if nothing else, we do need to go into a brief executive session. Mary Elizabeth, please, explain why.
It has to do with pending litigation, settlement possibly, pending litigation.
But not with health.
Oh, no.
No, not with you, no.
Again. Anxiety.
Okay, motion made by Supervisor Simpson, second by Supervisor McDonald to go into executive session. Thank you.
Read in the paper. We have to vote
Okay, no action was taken in executive, but, Mary Elizabeth, can you please explain what we need to do next?
Sure. The committee needs to vote on whether or not to accept the settlement, which has been offered by the defendant in Warren County, acting for and on behalf of Westmount Health Facility against Josephine Cooper and Naomi Cooper.
The amount.
The settlement is for the amount of $14,000.
Okay, motion made by Supervisor Simpson, second by Supervisor McDevitt. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay, thank you very much, guys. Motion to adjourn. Motion made by Supervisor Simpson, second by Supervisor Strau. All in favor?
Aye.
Opposed? Carried. Thank you.